I heard one of the Republican leaders say this was going to be Armageddon. Well, 2 months from now, 6 months from now, you can check it out. We'll look around. And we'll see.
That was from yesterday's second of two pep rallies where Democrats were downright giddy.
And if you want a big bleeping deal, we have got your big bleeping deal right here. Top Line starts right now.
Hello and welcome to ABCNews.com's Top Line. I'm David Chalian.
And I'm Rick Klein.
Each weekday we're bringing you the very latest political headlines, reporting, insight, analysis, everything you need and want to know about politics.
And it's twitter.com/thenote if you need and want to know even more, although we try to censor ourselves a little more than the vice president.
No, you don't.
A little bit more,
okay, just
only slightly.
Get us started. What's your top line?
Loose ends. There is another signing at the White House today, this one with a little bit less fanfare and a little bit less media coverage, but President Obama signing that executive order on abortion rights that really sealed the deal for House Democrats over the weekend. There are a number of fronts where they are kind of moving through the final machinations. David, the Senate is going through its vote-a-rama around Republican amendments that are going to be offered over the next couple of days. But we're just sort of laboring toward the real finish line where the legislative action will actually cease.
But it is amazing that yesterday's events were not possible but for this event today of the executive order of the abortion. Yesterday, of course, we all saw that on camera. Today, it's behind closed doors. Just
different politics.
The bizarre world here of political Washington. Playing offense. That's what Democrats are trying to do right now, following those pep rallies yesterday that the president held with the bill signing. The DNC, Labor, Democratic allied groups are now putting $5 million on the air in TV ads saying thank you to these Democratic members in tough districts who took a tough vote, and in some case with the DNC going on offense with Republicans, going in the air on the radio, hitting Republicans in blue states who voted no on this. This is about taking what is a legislative victory and trying to make it a political electoral victory.
And you're seeing here in really stark contrast the way that politics around healthcare has shifted in the wake of this passing. You're getting a lot more on offense than you are from the Republicans. So far, early on, even though Republicans were very eager to see this pass in a lot of ways.
And this may be where the money disadvantage, like at the NRCC running House campaigns, really has an impact. They very much would like to go on the air right now hitting on this. I'm not sure that they can.
To repeal or not, Republicans are now split over whether they should advocate outright repeal of the health care bill. It seemed like an easy and crisp argument to make and something the Tea Party crowd was thrilled to hear Republicans in Congress make. When you get down to the details, David, as you know, there are some things that Republicans actually want to maintain in this bill. So a lot of pushback from the folks on the Hill for the idea of an actual full-on repeal. Instead, they're saying, well, there's some things we'd keep, so it's repeal and replace.
Yeah, well, as soon as it gets, to repeal and something else and gets a little bit longer that maybe doesn't fit on a bumper sticker quite as easily as just repeal does, it starts muddying their message on the Republican side, and they have to be concerned about that. Reality superstar. Yes, it is the fourth top line, and yes, it is Sarah Palin yet again. She inks a $1 million per episode deal with Discovery for her reality show about her beloved Alaska. This comes at a time where she's also jumping in this healthcare fray, targeting members, 17 Democratic members who voted for the bill from McCain districts. But more importantly, this reality show issue, Rick, it's another signal that she is looking more to cash checks than she's necessarily looking to run for president.
Well, this is a classic example, too. This reality show, the topic sounds dreadfully boring. If it was anyone other than Sarah Palin involved, I can't imagine there being it getting made, much less $1 million per episode. But we're going to see her out there this week. She'll be campaigning for John McCain and campaigning against Harry Reid in Searchlight, Nevada.
Yeah, she'll be heading up a Tea Party rally there. We're going to begin with this battle now to frame the health care bill that is now the law of the land and try to make it into a political success for Democrats. We're joined by the chairman of the House Democratic Caucus, John Larson, Democrat of Connecticut. Thank you very much for being here, Congressman.
Happy to be here.
And congratulations to you on your legislative victory. But now the question is, do you find that a lot of the vulnerable Democratic members that you really had to talk to over and over again to get them on board with this bill, do they want you out there, the president out there, selling this bill, or would they rather move on and talk about something else right now?
Well, I think, as you alluded to at the onset of the show, I think sometimes good policy, which this is, becomes good politics. And I do think that members are going to be going back to their districts and talking about this. Members are coming back shocked that even editorial boards that were previously neutral or somewhat against are claiming and understanding this historic significance of this event, right up there with Social Security Medicare, and civil rights. And therefore, I think the members have received great plaudits for the passing of this bill. As the president said time and again, it demonstrates that the nation and that Congress and government is still capable of doing big things on behalf of the American people. And I think that's what's created the boost.
What's behind that boost? What's behind that kind of shift in mindset where there's so many Democrats who were dreading this vote now talking about how, well, this is something we can run on?
Well, you know, when you had, a period of 8 or more months where, in essence, you had no bill and had nothing you could discuss, you had 3 committees in the House, 2 committees in the Senate, and the back and forth, and then everything was focused on process and not actually what the bill does for people. And when you start looking at eliminating pre-existing conditions for children, when you start talking about closing the donut hole for seniors, when you talk about keeping your kids on there to their 26 years of age, largest tax cuts for small business and healthcare, and therefore the largest tax cut for middle-class people in healthcare, this is good stuff, and this needs to get out there to the public.
About one of those policy areas you just mentioned, we learned from the Associated Press today, though, the issue of children not getting health insurance due to pre-existing conditions. We thought that was going to go away this year. Now it looks like, no, that's not in the legislation. It's just like adults. They're going to have to wait to 2014, no?
No, I think with the ability of to pass regulations or even to further amend legislation, that's something that can be easily handled through regs or through the ability of us to amend another bill.
So there's possible for more legislative action kind of fixing that part of it.
Oh, I think there's, this is, the president said, this is the foundation, this is the start. There's going to be a lot more action and correction. I think it was wise to not have the full effect of this bill take effect until 2014, because when you're creating an exchange like this, you want to make sure that you get it right, and you want to make sure you get it right on behalf of the American people. But with regard to pre-existing conditions, I would dare say that even our colleagues on the other side, especially when it comes to children, et cetera, will join us in this. And in many respects, I think they need to join us in this. They're out talking about repeal. They don't want to be talking about repeal of children's benefits.
Congressman, you were in the thick of whipping this vote together as part of the leadership team in there in the House. Look back for us for 1 second. I know that obviously the abortion deal with Stupak and the executive order sealed it, but was there a moment before that where there was a turning point that you knew this was done? You got what you needed to do. You were going to have these votes.
I would say when Dennis Moore stood up in the caucus, a blue dog from Kansas who's not running again. And while he was standing there, he received an email from a person who works on his staff in Kansas. And she was thanking him for his courageous vote. And as he's reading this, with his lips trembling, he says she's just found out she's been diagnosed with cancer. And if this bill doesn't pass, doesn't know whether or not she'll have an opportunity to get insurance. And he concluded by saying, and she's just 24 years of age. You could have heard a pin drop in the caucus. Right. I think in the hearts and certainly in the minds of everybody in the caucus, we've been for reform from the outset. But when you have to do with regional disparities and other issues that existed out there, there was a lot of angst. There's no question about that. But I always felt confident we would have the 216 votes that were required. Right. And we superseded that.
Mr. Larson, as you go to the public with this legislation, what are the metrics or what are the measurements that you think are fair to apply toward this to say whether Democrats made good on the pledges that are contained in this bill or not?
Well, I think, as the president said yesterday, I think the public is going to take a look and realize that there are no death panels. They're going to realize that if they like their current insurance, they're going to be able to keep it. That there are going to be added opportunities. And as we progress with these bills, I mean, speaking as a father of 3, knowing that my children, including my 20-year-old in college, can now stay on my policy to 26, those are the metrics. And then I think also the ability to get out there with the various groups, including the AARP, the American Medical Association, healthcare professionals, et cetera, all the people that support this. I think now the education, the true education process begins, because the bill is now law.
Congressman John Larson, chairman of the House Democratic Caucus, thank you very much for being here today.
Pleasure to be here.